So previously we had discussed how follicles started growing, and you must remember that follicles are growing in both of the ovaries, and one of the follicles out of all the follicles, 15 to 20 follicles that started growing in both of the ovaries, one of the follicle it had overgrown all other follicles, and it is called dominant follicle. Only this follicle remains and all other follicles are destroyed, right? So each month randomly one of the ovary may release secondary oocyte out from its dominant follicle. So in one of the occasion, one of the month, for example, right ovary may be forming that dominant follicle. In next month, maybe left ovary may be forming that dominant follicle, right? So that is purely random. So today we will discuss how the process of ovulation occurs and what happens before ovulation occurs. Right? What is ovulation? Ovulation means release of secondary oocyte from this follicle, from the dominant follicle, and release happens into the fallopian tube or uterine tube. Right? So as we have discussed that estrogen level, it begins to gradually rise up, and this is because the follicles were growing, and these growing follicles, they started releasing estrogen. So estrogen level gradually rises and ultimately it reaches its peak. Ultimately it rises up to its highest level, right? And due to this very high estrogen, one of the hypotheses is that due to this very high estrogen level, during mid of cycle, 12 or 13th day, somewhere between 12 or 13th day of cycle, suddenly there is a surge of LH as well as FSH. There is sudden rise in level of LH as well as FSH, but the rise in level of LH is much greater as compared to rise in level of FSH. And this process, that when there is sudden surge of LH, it is simply called LH surge. Of course there is FSH surge also, right? But LH surge is much more important and much more significant here. We will discuss that why it is significant. So here is this primary oocyte still arrested in prophase 1, and that is living inside the secondary follicle. Primary oocyte arrested in prophase 1, living inside the secondary follicle. And now because this primary oocyte, it has also grown fully, it has accumulated as much cytoplasm and as much organelles that it needs, right, for the nourishment of embryo and for whatever the requirement for embryo is. Also follicle has fully grown, so it is the time that it should complete it should be allowed to complete its meiosis process, right? So how it will complete the process of meiosis? As I have told you, there is LH surge, so lots of LH will be released, and this lots of LH, it will bind to these granulosa cells on their LH receptors. Remember in previous lecture I have described that how LH receptors are primed on these granulosa cell by the effect of estrogen. So here these LH receptor, on these LH receptor, LH hormone will bind, and this LH will order these granulosa cell to release the rest. Remember, as I have told you in the lecture of oogenesis part 1, that it is that these follicular cells that arrested the primary oocyte at first place. So again, to release the arrest, these follicle cells must be ordered to release the arrest. And what I think of all this story is that this LH, which is actually luteinizing hormone, it is like lieutenant general of the army, right? It is like army chief who is ordering these policemen, granulosa cells or follicular cells. These are policemen who arrested primary oocyte. So army chief, LH, lieutenant general, it will order these policemen to release the arrest, and on the order of this general they will release the arrest, and it will complete the process of meiosis 1 and form first polar body, and then it will quickly start meiosis 2 as well, but again it will be arrested, and it will be arrested at metaphase 2 of meiosis 2, and it will remain arrested till it is released, and then sperm come, and when sperm binds with its receptors on zona pellucida, only then it will release the arrest, otherwise it will never release the arrest. As Dr. Najib says, it needs that magical touch of sperm to release the arrest, the second arrest. And what is polar body? We have a complete lecture on polar body. If you want to know what is polar body, please do watch that lecture. Then what happens? So one of the function of LH is to release the arrest of primary oocyte. And remember, as the primary oocyte completes the process of meiosis 1, it is now not primary oocyte, it is now secondary oocyte, and secondary oocyte is arrested in metaphase 2. If this secondary oocyte completes the meiosis 2 as well, then it will become what it will become? It will become first oocyte, and then it will mature into ovum, the mature ovum, right? So one of the function of LH, very important role of LH, is to release the arrest. Then it has another important function. As I've told you, theca, and especially theca externa, it is rich in blood vasculature. It has so many blood vessels. So LH, what it will do is that LH will release special factors, it will release special prostaglandins, and these prostaglandins will increase the permeability of this blood vessels, right? First of all, what it will do, it will cause dilation of these blood vessels, vasodilation of these blood vessels, as well as it will increase the permeability of this blood vessels. So what will happen then? So the some fluid will seep out of these blood vessels into the antrum. So naturally what will happen, that this antral fluid or follicular fluid will increase, right? And as it will increase, overall size of follicle will increase. So follicle will swell up. Due to this swelling up of follicle, and as this follicle is lying near the periphery, near the wall of one of the wall of ovum, what will happen, that at this place there will be a special nipple like bulge on the ovary, and this is called stigma. So stigma will be formed due to this very large follicle. Clear? And by the way, this complete follicle, this dominant follicle, this follicle that has completed its meiosis 1, and this is ready to be released into fallopian tube. This is called pre-ovulatory follicle. What is the name of this follicle? This is pre-ovulatory follicle, and there is another special name for this follicle, that is Graafian follicle. It is Graafian follicle, or simply pre-ovulatory follicle. So of course this wall is having its blood vasculature as well, but due to this very large follicle that is pushing against the wall, it is mechanically pushing against the wall, and this increased mechanical pressure on wall will physically compress the blood vessels of this wall, and this wall of stigma, it will weaken due to ischemic damage. It will be weakened. and it is now a weakened wall. Then what will happen? All this is due to LH and LH surge, right? That is not just that. What happens that inside this follicular fluid, these granulosa cells secreted special enzymes as well. Molecular cutters are there. What are these molecular cutters? These are special proteinases. Proteinases enzyme, protein cutting enzymes. For example, special collagenases are there. And what these collagenases will do is that they will dissolve this wall, and they will rupture. First of all, they will cause rupturing of this follicle, and they will damage this wall, and they will damage this wall in such a way that this secondary oocyte, it could be released outside the ovary. Clear? And what else happen here, that there are special myoepithelial cells as well in the theca. In the theca of this follicle, there are special myoepithelial cells. What are myoepithelial cells? They look like epithelium, but they have property of muscles as well. Myo mean muscles. What property of muscles they have? That they can contract just like muscle. So as they will contract, although they look like epithelium, but they can contract, and as they will contract, they will increase this intrafollicular pressure here. So here there will be increase in pressure, and when there will be increase in pressure inside the follicle, it will push this secondary oocyte that is still stuck here, and it will push into this peritoneal cavity. Clear? It will be pushed into peritoneal cavity, but fortunately it cannot fall into peritoneal cavity. Why it cannot fall into peritoneal cavity? Because this fallopian tube or uterine tube, it has special processes, fimbriae, right? And these fimbriae, they are looking for this ovum. As soon as ovum is released into peritoneal cavity, they will suck up this this secondary oocyte inside. They will, like this, they will pull it inside the lumen of this uterine tube, and then inside the lumen there are special ciliary process which will cause, due to ciliary motion, they will take it up back towards the infundibulum of this uterine tube. Clear? So here this secondary oocyte, it is now released into the uterine tube or fallopian tube. Along with that, some follicular fluid will also come inside, that is not shown in this diagram, and some granulosa cells are also there, and these granulosa cells, which were previously forming the cumulus oophorus, these granulosa cells are arranged in such a fashion that it looks like a crown surrounding this secondary oocyte. And because it looks like a crown radiating out from the secondary oocyte, it is named, this structure, this collection of granulosa cells surrounding this secondary oocyte, it is named as corona radiata, right? It is not cumulus oophorus. Of course, most of these cells were previously forming cumulus oophorus, but now they are named as corona radiata. Plus, what happens to this structure that remains behind? As there was rupture of some blood vasculature here, so some of the blood, it entered into this remaining structure, right? And this structure, this part of follicle that remained behind, it is now full of blood and some blood clots as well. So now we call it corpus hemorrhagicum, right? So after the ovulation, after the release of Immediately after the release of secondary oocyte into uterine tube, the structure that remains behind, the body that remains behind, it fills up with blood and blood clots, and we call it blood filled body, or technically we call it corpus hemorrhagicum. So it is nothing complicated, and within it is just a temporary structure. Within a day or two, macrophages will clear these blood clots, right? Within a day or two, macrophages will clear these blood clots and it will be converted into corpus luteum. But before that, here an important concept, that what is Mittelschmerz. As you must have guessed by now, that you might have noted by now, you are intelligent people, that this release of release of secondary oocyte or ovulation, it is an inflammatory process. There is this rupture of a part of a part of ovary. So it is an inflammatory process, and wherever there is inflammation, although it is a normal inflammatory process, and wherever there is inflammation, it may lead to some pain as well. So during mid of cycle, when ovulation is happening, it leads to, in some women, not all, in some women, and sometimes it leads to unilateral pain, unilateral lower abdominal pain in some women, right? And this is called Mittelschmerz. And this pain may be right sided or left sided. Again, it depends upon that which ovary release the secondary oocyte. If right ovary release the secondary oocyte, the pain may be right lower abdominal pain, and vice versa. What this term Mittelschmerz mean? It is a German word, and Mittel means mid and Schmerz mean pain. So mid cycle pain. In short, you can call it mid cycle pain. And because of course you know it is happening in the mid of cycle, so it is mid cycle pain. So finally, when the blood clots are cleared by macrophages, then also along with that, LH also acts on this structure, and LH convert these granulosa cell into special cell that will now secrete, from now onward these cells will secrete progesterone. Previously it was secreting estrogen, now they will be mainly secreting progesterone. They will also secrete estrogen, but in much lower quantities. Mostly and mainly they will secrete now progesterone, right? And along with that, these cells, they will accumulate lots of fat to these estrogen and progesterone, these are steroid hormones, and they are synthesized from fat, from cholesterol. So they will accumulate lots of fat in order to synthesize these hormones, right? And they will acquire a yellowish color, probably due to this fat content. They will acquire this yellow color, and now we call it yellow body. Corpus mean body, luteum means yellow, so it is yellow body. And this formation of corpus luteum, it demarcates the beginning of post-ovulatory phase, right? Post-ovulatory or luteal phase will start as soon as corpus luteum will form. And because LH is directly as well as indirectly, LH is causing formation of corpus luteum, that is why this LH is called luteinizing hormone. It is causing indirectly by causing the process of ovulation, as well as directly by forcing these granulosa cells to convert into specialized progesterone secreting cells called lutein cells. So luteinizing hormone, or LH, what they say is that LH luteinizes granulosa cells. What is the meaning of this sentence is that LH converts granulosa cells into lutein cells, progestin secreting cells. right? So finally estrogen level after the ovulation will drop, right? And LH and FSH will also come to their baseline after doing this very important task which we have already discussed. And finally progesterone level will increase beyond this point. What is now secreting progesterone? You must remember that corpus luteum is secreting progesterone, and now from this point onwards it is post ovulatory phase, which we will discuss in next lecture. So here is that overview slide. You know all these things. That first of all we just gonna review this, that first of all there is peak of estrogen is achieved, which leads to LH surge, right? And then this LH surge, it what it did, it resumed the prophase 1, arrest in prophase 1, and that leads to formation of secondary oocyte, and ultimately it leads to ovulation through a multi-step process we have already described. And it also causes luteinization of granulosa cells, and these granulosa cells, they are now converted into what they are converted, they are converted into lutein cells, and the structure that remained behind is corpus luteum, and formation of corpus luteum demarcates the start of post ovulatory phase. And during this time period there is not much changes in the uterus, and not much changes in the cervix as well. But regarding the basal body temperature, as soon as estrogen levels start to rise, as soon as progesterone level, as soon as progesterone level begin to rise, there will be a slight rise in basal body temperature as well. I don't know what is the significance for this. Probably this increased basal body temperature, it is the need for development of baby. Maybe baby needs that motherly warmth for proper development. I don't know what is the reason, but that's it, that's what it is. So that was about ovulation and peri-ovulatory period, and about LH surge. Thank you so much for watching this video.